Every winter, Delhi and large part of North India choke under the thick blanket of toxic air. Despite warnings and several public health emergency measures, pollution levels continue to rise, posing a grave threat to our health. To discuss the impact of this toxic air on our health, I have with me Dr. Randeep Guleria, country's top pulmonologist and former director AIIMS. Thank you, Dr. Guleria, for joining us. Doctor, according to certain estimates, we all are smoking more than 7 cigarettes every day. Is this correct?
Yes, if you start looking at data, which is the AQI that we currently have, it's in the poor, very poor, or severe range, and it's in the same category as what we call passive smoking. So, number of people who live with people who are active smokers, they tend to inhale the smoke which is from the cigarette in the environment, and we are doing the same thing, but instead of cigarette smoking, it's the air pollution from different sources. So, all of us actually are chronic smokers.
Right. And how does this affect our body? Does this affect in the same manner we are smoking?
So to some extent, much more because the toxic products may be more harmful, and especially this is also harmful to people who are otherwise not exposed, like young children, pregnant women, the elderly, and they also have to face the harmful effects of smoking. Also, it's important to understand that pollution has a lot of fine particles known as PM 2.5, ultra fine particles, which are less than zero point 0.1 micron. And these are so fine that they are about 1/100th of a human hair. And they go deep into our lungs and they can then enter the bloodstream, cause swelling of the blood vessels, which can lead to effects which are more than just pulmonary effects. They can lead to heart attacks, strokes, and many other diseases which occur because of chronic exposure to high levels of air pollution over a long period of time.
Doctor, specifically talking about children here, do you think, considering the level of AQI we are seeing today morning, it was touching 600 and was entering into the severe category, do you think we should move children from the offline classes to online once again?
Children are more vulnerable because of two or three things. They have growing lungs, the lungs are still growing, and there is a lot of data which suggests that children who are living in such a environment, their lung health becomes less, their lung capacity decreases. Although there are studies which have recently shown that if you move them to a better environment or the environment improves, the lung catches up in terms of the decrease in the lung capacity which occurs because of pollution. But therefore, there is definitely harm the children have. Also, it predisposes them to chronic cough and allergy like symptoms. Therefore, yes, children either should avoid going out, stay indoor, and make sure that the indoor environment has better air quality, and also, if possible, stay at home or stay inside the classroom rather than going out.
And doctor, when we talk about infants who have just born or who have not even completed 6 months into this world, what do you think about their lungs? Because you're a pulmonologist, you would know that what sort of development their lungs would need. Is this the environment they should be into?
Definitely not, and we should start even before that. Even when you talk of pregnant women, there is a lot of data which is coming which suggests that when pregnant women are exposed to high levels of pollution, it not only affects them, but the fetus and therefore the newborn. Studies suggest that it leads to what is known as intrauterine growth retardation. That is the child that is born is low birth weight. Sometimes it can lead to abortions. It can lead to it affects the mother also, both in terms of acute effects and chronic effects, which sometimes can lead to postpartum depression also.
Doctor, will you suggest that people should move out of Delhi NCR for some days till the time AQI improves to the places with cleaner air quality?
So, to some extent, when AQI is very bad, some people do move out, especially if they have relatives or the children staying in other parts of India where the AQI is better. They
Mhm.
do feel better, but it's not a practical solution. And if you look at the air quality throughout the year, on many days, even when it's not winter, air quality continues to be not that good. Not it does not meet the WHO standards, and therefore, even when we are living in Delhi throughout the year, in most of the days, 60 to 70% of the days, the air quality is not acceptable. So this is just a short-term solution, and we need to look at a long-term solution because this is not practical for everyone, especially people who are working here, who have children going to school, and have other responsibilities. Therefore, I think this is something which is not practical. But yes, people who do manage to go out during the winter months to places which are less cold and less polluted, they do feel better in terms of the chronic lung or heart diseases.
Right. Uh, Doctor, do you think that we have already seen measures like artificial rain, and we have seen that there was a little benefit from that? Do you think there are other practical solutions, or the what kind of interventions we should prioritize right now?
So I think we need to have an action plan in place where all stakeholders, policymakers, general public, the source where which is actually the emitting source for pollutants is identified, and then we should work on how can we decrease the emission, how can we make vehicular traffic better, how can we make it more the city more environmentally friendly, and encourage means of travel which are more environmentally friendly. What can we do in our own colony to prevent pollution from happening? We do see a lot of small fires burning in various colonies in winter just by the security personnel to stay warm. How can we help in not seeing that that does not happen in our colony and provide support to them? Decrease or have good norms which are followed when it comes to construction. uh, how can we really help farmers so that burning does not happen as it happens every year? So I think we should look at the source and then develop a sustainable solution which is practical, doable, and this is something which can be done. It has been done in various other cities in the world, whether it be Beijing, which was very polluted during the Olympics, London, New Mexico, or even Los Angeles. And if you look back, it's been done in Delhi also. When we had in the late 19s, Delhi was again having very poor quality air. And then CNG came in a big way. People felt CNG would be difficult. But when CNG came in for some time, the air quality did improve because vehicles started public transport and public vehicles, taxis were all using CNG. But all those gains we lost over the next few years because of construction, more diesel vehicles, and we were back to very poor quality air.
Right. Doctor, what will be your word of caution as we as a country are failing to prioritize air pollution as a public health emergency? How do you foresee the next 5 years if we continue to go like that?
So I think we have to balance our industrial and economic growth with good environmental growth and environmental protection. This is not happening. We have grown a lot economically. We have become, but we have done that at the cost of our own health. And as we see, the burden of disease in our country is shifting to what we call non-communicable diseases. And one of the major contributing factors to that is air pollution. And unless we do that, the burden of disease in terms of the health, not only our own health, the health of the subsequent younger generation, the new generation, is suffering. This will lead to more diseases, this will lead to more health cost, and this will increase the economic burden. That's why I think we should look at this as a public health emergency. If you look at the global data and the Health Effect Institute data of 2024, it suggested that 8.1 million people died in 2024 because of air pollution, which is more than the number of people that died because of COVID-19. So that is why it's very important that we look at this from a perspective that this is a silent killer, a medical emergency, and we need to start taking action so that if not today, over the next few years, we are able to bring down the poor quality air in central India to something which is better, acceptable, and something that we can be proud of.
Right. Doctor, before I let you go, some advice for our viewers who want to survive this season with this AQI. What should they do?
So I would really say that especially children and elderly, but those who have chronic problem, respiratory, cardiac, or other chronic illnesses, they should not go out during early in the morning or late in the evening because of cold weather. The air quality tends to be bad. Pollutant sits more at ground level, and if they have to go out, monitor the AQI, wear an N95 mask, don't exercise outside, drink plenty of water, take green leafy vegetables, fresh fruit. If you have to exercise, do that inside. And also, if your symptoms worsen, if you have more breathlessness, if you feel chest tightness, if you have some chest discomfort, you must consult your doctor so that your medication can be increased or modified so that you don't really land up in the emergency with acute breathing difficulty.
Thank you, Dr. Guleria, for joining us.
Thank you very much for having me.
Thank you so much, sir. Thank you so much for taking time for us. Thank you.
Thank you. Thank you, and all the best.
Thank you so much, sir.